Thank you, Madam Speaker. Colleagues, this morning I rise to ask for your support for House Bill 2010. House Bill 2010 continues the expansion and availability of Medicaid and the approach to funding that expansion and availability that our state has utilized for more than 15 years. As federal contributions to the Affordable Health Care Act's Medicaid expansion ramp down, and as one-time funding streams begin to sunset, our state must take a greater portion of this program's cost in order to protect our most vulnerable citizens and residents. By passing a 6-year Medicaid package, we also have an opportunity to ensure greater stability for the program for the long term. The Oregon Health Plan provides health care for the most vulnerable residents in our state: children with special needs, low-income families, low-income adults and seniors, and pregnant women are among the 1.1 million members and utilizers of the Oregon Health Plan. House Bill 2010 extends the sunset dates for hospital assessments and insurance premium assessments and continues the Oregon Reinsurance Program. Since the year 2003, Oregon has relied on a hospital assessment as a foundational mechanism to help fund our state's share of the cost of Medicaid. In 2017, we heard calls to broaden our tax base for the Oregon Health Plan, and the funding mechanism contained in House Bill 2010 does that. Specifically, this bill increases insurance premium assessments from 1.5% to 2% and expands the assessment to include stop-loss insurance, which broadens the base to include large employers. Part of this assessment also continues to fund the Oregon Reinsurance Program. That program has successfully reduced or mitigated premium increases for working Oregonians by 6%. For the 2019-21 biennium, anticipated revenue for House Bill 2010 is $334.5 million. This estimated revenue, along with federal matching funds that will come with it, will support the Oregon Health Plan, as well as the payments from the Oregon Reinsurance Program, and help stabilize health insurance rates and premiums. Colleagues, it's worth pointing out that every state except Alaska uses provider assessments to help finance their Medicaid program. House Bill 2010 also increases reimbursement to the Oregon Health and Sciences University from 84% to 87% to manage the university's costs of providing Medicaid service to their patients. The increase to 87% is consistent with the current reimbursement level provided by the Oregon Health Authority and does not result in an additional fiscal impact for this bill. Colleagues, Madam Speaker, this bill comes to the floor after votes taken in both our Health Care Committee and in our Committee on Ways and Means. And while House Bill 2010 is not a complete solution for addressing the funding gap that we have with our Medicaid program, it is a very much essential part of that solution. Passing these assessments now will give us ample time in the remaining months of our session to engage in more discussion about how we might fill the remaining funding gap and give Oregon's residents the assurance they need for this very vital program. Thank you. Thank you, colleagues. The assessments that are contained in House Bill 2010 were negotiated as part of a larger budget package for the Oregon Health Plan throughout the interim of 2018 among a very diverse group of stakeholders. I want to thank those stakeholders, many of whom are here in the chamber listening, who came to the table and gave us their input and their suggestions into a funding plan to assure Oregonians who lack income do not have to worry about being able to afford to go see a medical provider when they need to go to a pharmacy when medicine is prescribed. I want to thank the member of this body who offered suggestions on how to improve the bill. It's my belief that he cares very deeply about Oregonians who rely on this program. Though for the record, I believe I have to say that the proposed amendments that would have exempted either school districts, that was the -1, or small businesses, the -2, as heard in committee, they're not feasible. The exemption for school districts, the -1, as discussed in the Healthcare Committee and in the Human Services Subcommittee of Ways and Means, probably would require federal review and approval, where this package that we're voting on today, Madam Speaker, does not. And I think Representative Susan McLean did a very good job of explaining the complexity of that issue. That review, should we be subject to it, would put our funding for this very important program at risk. House Bill 2010, as presented, carries very little risk. It can be submitted to our federal government, to CMS, for its approval with confidence. It's also my understanding, Madam Speaker, that the exception for small businesses from the reinsurance assessment, as proposed in the -2 amendment, would violate the Affordable Health Care Act and federal rules for the single risk pool. Thus, that amendment, Madam Speaker, was also deemed not feasible. Colleagues, Oregon was among the first of the states to expand Medicaid. This is something that we should be very proud of. If there's any doubt about our decision to do this today, then let me assure you that Oregon voters reiterated their commitment to our Medicaid expansion a little more than a year ago when they overwhelmingly approved Ballot Measure 101. And during that same time period, across these United States, we are observing that states who have resisted Medicaid expansion, states like Idaho, Nebraska, and Utah, are all responding to mandates from their voter asking them to do so. Oregon has led on Medicaid expansion for more than 30 years. When 20% of our children were uninsured, we found a way to expand access to a basic level of care. The rate of uninsured Oregonians, because of the Oregon Health Plan, has decreased dramatically. And now all children in this state are eligible for health care coverage. I want to reiterate that this bill has the support of hospitals and insurers who recognize that not funding this program would be devastating for Oregonians. Colleagues, let's also be very clear. If we don't pass this legislation, we're all going to end up paying more. When the number of uninsured Oregonians rises, so do costs to our overall health care system. When fewer Oregonians are insured, we are collectively less healthy. Uncompensated care rises, costs shift, and we all pay the price, including school districts and small businesses, Madam Speaker. The components contained in House Bill 2010 create a stable foundation for funding our Medicaid, our Oregon Health Plan, for the next 6 years, protecting 1 million Oregonians, including 400,000 children. And with that, colleagues, I urge very strongly that we take this first step today and secure this health plan and pass this bill.